name is Ryan Miller. I'm the physical therapist and director of your physio resource for the Aspen providers in Central Florida. And we're here talking to Mimari. Mimari, thank you so much for joining us on this video today. We'd like to talk a little bit about your situation with treatments that you just had at our clinic.
Sure. Thanks for having me.
Thank you. Well, let's talk a little bit first about your history. The first thing that I want to bring up here is that you had your original breast augmentation performed about 15 years ago, about 14 years prior to having your revision surgery. Tell us a
Right.
little bit about your symptoms. What symptoms of capsular contracture did you experience over those years?
Lopsidedness. So on my left side was the one that was encapsulated. So this one was super high. I was always wearing a push-up bra to kind of like balance it and like lift the right ones so that they weren't. And then one was like super hard up top. It was like really hard. Like my chin would almost touch it if I looked down. So like what would happen is I couldn't wear a sports bra because you could obviously tell that it was lopsided. So I would always be wearing push-up bras and my chin was always like right there. So it was hard and it was high. That was like the biggest inconvenience, which gave me a little bit of, I guess, less confidence. Like, you get boobs, you want to wear bathing suits, you want to wear lingerie, and you really can unless everything is like a push-up bra, which really makes them look fake anyway.
Right. So it impacted what clothing you were able to wear.
Yeah.
You had a certain sense of embarrassment about the overall aesthetics. A lot of times women tell us that if they try to hug a loved one or something,
Yeah,
they
they
feel
feel
that
it.
embarrassment about such a hard
Yeah.
breast implant and so forth. And so those are major issues of capsular contracture that we treat quite a bit. In your particular circumstance, and unfortunately the time period was beyond a 10-year time period beyond surgery, which we don't really recommend treatment beyond 10 years. At that point, we're recommending a patient have revision of their surgery anyway, because new implants should be incorporated at that time period.
Right.
But a lot of times with patients with those symptoms, we do have a program that can take care of those symptoms and prevent future surgeries, which is another course of action that Aspen Services provides. But in your particular case, last year, you went ahead with revision surgery for both sides. And then after surgery, your doctor recommended that you come in and have these Aspen treatments to try to prevent an onset of capsular contracture. We didn't see any hardness at your initial evaluation, but we did see an asymmetry. We did
Right.
see that left side was sitting much higher than your right side. You were still having a little bit of drainage situation.
Right.
All of that was still kind of happening after surgery, but we got you in here. I think it was 2 weeks after surgery. We began this Aspen program, which our preventative program is going to be 5 visits over the course of 5 weeks. And so during that treatment, we were able to help you. We were looking at your before and after pictures. The symmetry was just amazingly different. We
Yeah.
had almost perfect symmetry, if not exactly perfect symmetry at the end of that. Softness was great on both sides. And
Right.
then tell us a little bit about the pain symptoms and other symptoms that you were having regarding after surgery last year.
So I mean, obviously it's 2 weeks after surgery, the massages, they didn't tickle. They were uncomfortable, you know, but they were well worth it because everything now looks great. In terms of pain, the massage was like on a scale of 1 to 10, maybe like a 4. The first 2 visits, but then things started softening and like falling into place. And that's when I like got a little bit of like the shooting pains. And I think that's because things were falling into place, but maybe it's because my body was wanting to create like another encapsulation or whatever it's called.
Right.
So that was like the most of the pain. It was typical breast augmentation pain though. Like, I couldn't lift, I couldn't like turn knobs or anything. But in terms of the massage, I think that it actually sped up the healing process because I had that drain and I was sore when the drain was taken out 2 weeks into, the stuff with you and or maybe right after. But what I'm saying is that it was still sore, the wounds and all of that. I got some tips on how to do the massages at home so that I can maintain the softness and the natural look at home. And I also got that ace bands to kind of like bring them down, which really helped keep them balanced. But there wasn't really much pain, I guess.
Right. There are, yeah, protocols of the treatments that you're discussing here. We won't get into details with that, but yeah, the overall product of our treatments ended up with resolution of those pain symptoms almost
Yeah.
100%. And we also had discussed on the final visit that I did with you a sensation situation. So you had numbness that over the course of the treatments, you also saw that resolve fully. Is that right? You had no numbness remaining on that side after the treatments were performed?
Right, but like to be clear, like after my first breast augmentation, my nipple was numb for 15 years. So it was weird that after I had this one and the massages and everything, like I have nipple sensation now. So I think that the massages also contributed to like having some of course there's still some numbness on the side, but like I can feel my nipples again, which is really good.
This is actually a pretty common symptom that a lot of patients report to us. And then the treatments, the way that this Aspen Care provides treatment for a patient, we do mobilization, we do softening, that increases circulation, even vascularization changes. So that blood supply to that area can actually help to remedy those numbness concerns. And that's actually a very big piece of what patients tell us they feel is the product of the Aspen treatments. You know, the symmetry, the softness, but also the return of sensation can be a
Yes.
major influence in a person's well-being. So that's
Yeah.
great. Thank you so much for talking about that. Yeah, we've talked a lot about how certain ethnicities, and your ethnicity is Puerto Rican, so
Yeah.
you're a Latin patient, and we do see a higher prevalence of capsular contracture concerns in the Latin community as opposed to some other ethnicities. We know that these surgeries can be performed by wonderful surgeons. Wonderful surgeries can be
Yeah.
done, and capsular contracture can still be suffered by patients. It really isn't a product of a poor surgery or any kind of a malfunctioning of the surgical procedure, but a person's predisposition can be a big issue, a big factor moving forward. So, a lot of times, what we'll see is these Aspen preventative programs can keep these symptoms at bay, can prevent a new onset of capsular contracture. And a lot of times, if we can catch them early enough, can even get rid of symptoms without the need for another surgery, a revision surgery. So, in either of those situations, the Aspen program can be really beneficial to a patient with the types of symptoms that you had. We very much appreciate you spending a little bit of time with us today talking about your situation. I hope that
Sure.
other patients out there that are having similar situations can kind of learn from this and see and maybe respond to this thinking, I understand what she was going through. This is something
I
that
hope
I'm
so.
having I'm going through as well. And we have wonderful treatments and procedures that can really make a big impact on that to the positive. So we appreciate you helping us get this word out
I
there to other
appreciate
customers.
you. Thank you. I feel, balanced again. Thank you.
Wonderful, Mimari. Thank you so much for that.
Okay.
Hey everybody, Tim Wyatt, clinical specialist with the Aspen After Surgery Center. Special thanks to Ryan Miller and his patient Mimari for doing a great little expose here on preventing capsular contracture after surgery. Thanks to everybody for that information. Hey, don't forget, anybody watching this video, if you are having breast augmentation surgery, if you had breast augmentation surgery, if you're dealing with capsular contracture, you have options to prevent having surgery, or as you heard in Mimari's case, what you would absolutely want to be a part of to prevent a re-encapsulation after surgery. Take a look at the 877 number on the banner below. Hit us up, call us. Don't forget to like and subscribe. If anybody has any questions, we do respond to our online comments. So leave us a comment below of what you thought, questions that you have, anything that we can do to help you out. Check out our other socials. Everybody, this is Tim Wyatt, clinical specialist, signing off. We'll see you on the next video.